Hello everyone, this week we have very interesting video. It's necessary to all people to know, touch and see yourself. Let's see how and why should we touch and see ourselves, actually inspect ourselves. Let's see, this logo presents a summary of our video. Look at this carefully. By your hand, specifically finger pads and your eye, you can discover a mess. First step to look and see. Actually, the best time is shower time and towel time, when your body and your skin is fully clean and ready to see and touch. In addition to this, you need enough light and mirror. Inspect yourself or look at yourself carefully from top of your head and to your toe, looking for any lesion, ulcer, changing color, asymmetric shape, swelling, mole, or any alteration.
So let's do this systematically.
We start with face, head, neck, and oral cavity. Neck is a very mysterious area. It's like that galaxy is there or many lymph nodes. You can inspect and palpate your neck, but it's not recommended for elderly to palpate their neck, and any swelling that you feel is alarm sign. Keep it in your mind that thyroid and 4 parathyroid gland, actually esophagus and trachea, are in your neck. It's a point to know that oral cavity is a live environment. As you know, the superficial layer of your skin is not alive. The alive cells are come from with anything that you eat or put in your mouth, or something like smoke or hot to your milk. It can be dangerous. So just pay attention to your teeth, gum and mucosa, and looking for any lesion, ulcer and changing color. See and palpate. Actually inspect and palpate the whole area, and specifically breast. So, breast self-examination for women is administrating. A breast self-exam should be performed a few days after her period ends. For those who are postmenopausal, a breast self-exam should be performed on the same day of each month, such as the 1st or 15th day of the month. When you wanna inspect your breast, with your arms at your side, visually inspect your breast, looking for any changes in the contour or shape of the breast, any dimpling, swelling or other skin irregularities on or around the breast, or any changes in the nipple. Next, rest your palms on your hips and press firmly to flex your chest muscles. Look for any dimpling, puckering or other changes, particularly on one side. You can see your breast actually when your arms above your head and you are bending forward in other position. So to palpate the breast with the pads or flats of your 3 middle finger, check the entire breast and armpit area, pressing down with light, medium and firm pressure. Check both breasts each month, feeling for any new lumps, thickening, hardened knot or any other breast change. You can palpate your breast with this kind of pattern, as you see: wedge pattern, vertical strip pattern, or clock pattern. Next area is your back. See your back by your mirror or ask your friend to check it. Actually, ask a reliable person. About your abdomen, you can't do much, but see your abdomen and look for any change of size, shape and skin color, and in palpation any pain or swelling or mass. Next part is upper limb, arm, forearm, hand, nail, and you should find any change in color and swelling. Specifically, you can palpate armpit, elbow. These are the region to find lymph node. It's a lower limb turn, so pay attention to your hip, specifically inguinal lymph node, or thigh, knee, leg, foot, nails. Like the upper limb, any change in color or swelling. Maybe you think that limbs have the least important to find any pathologic findings, so you should note that limbs are the most common area for sarcoma. Now we're gonna talk about the genitalia area. About a man, they should see and touch their penis to find any wart or lesion, specifically their testicle. There is a guideline about self-examination of testicle. So let's review. How should we do testicular self-examination? Are you ready? First, check one testicle at a time. Second, hold the testicle between your thumb and fingers of both hands and roll it gently. Emphasize on directly between your fingers. If you notice any of these symptoms, hard lumps or smooth or rounded bumps, changes in size, shape, or consistency, see a urologist right away. The women actually should see their genitalia and touch it. And there is a point that a small mirror, enough light, and proper position are needed. So find a space where you feel comfortable and private, such as a bathroom or your bedroom. Make sure you have a good light. Get into a comfortable position. Either lie down, put one foot on a chair while standing up, or sit in a position where you can see your vulva with your legs astride. You can examine yourself by looking and feeling. So, last but not least, the laceration is the anus that we should see by mirror and enough light during the time that HPV virus prevalence is increasing. Look for any warts or ulcer. The last point, where the lymph nodes are. Parotid gland, back of head, neck, clavicle, armpit, elbow, abdomen, groin, popliteal, and posterior tibial. That was a short summary and everything you need to know about self-examination. I believe that everyone should know this information, so let's share this video to help your people that live around you.